Hello and welcome to Southern New South Wales Local Health District. My name's Liz Mullins and I'm the Executive Director of Medical Services, and it's so great you've come to help us out to provide terrific care to our patients and our community. As a locum, we really value you coming and are very grateful for your skills, and I thought that this might be a useful way to give you an overview of not only the district but the sorts of works that you'll be going to do. We will send you a whole lot of information, but I've worked with doctors for a very long time, and being a doctor myself, we don't really love all that information. So we thought this might be an easier way for you to have a sense of what the district and the hospital you're going to work in is like. At Southern we have two C1 hospitals, so our big hospitals are at Goulburn and South East Regional in Bega. And I guess to get a sense of what a C1 hospital is, they both have an intensive care unit. They both have subspecialty surgery, busy EDs, obstetrics and paediatrics. The rest of our four main hospitals are C2 hospitals, so they're at Cooma, Queanbeyan, Batemans Bay and Moruya. And they have standard inpatient-based services in general medicine surgery. Some have obstetrics, as well as all having busy emergency departments. In terms of what we ask from you, it's what anyone I'm sure would ask for you. We want you to come and do a standard day's work, and that typically means for surgeons coming in about an anaesthetist 7:30, for physicians or GP VMOs or other locums coming in at 8 o'clock. You'll be working sometimes with registrars, well certainly at the larger hospitals, but at the smaller hospitals, particularly at the weekend, you'll be largely working with our nursing colleagues, of whom we are enormously proud and provide great support and service. So they'll be your main point of contact. Many of you will be on call, and you will note that after hours we have fairly thin medical cover. Typically there's one doctor in the emergency department and they're the main person for the entire hospital. Both ICUs have doctors on site, but for the rest of our places there's only one doctor on site. So when you're on call and the nursing staff or the registrars ask you to come in, we'd be really grateful if you come in straight away. There aren't fellows, there aren't trainees, there aren't all sorts of other doctors walking around, and our staff are very mindful of not interrupting your rest time. But when they call, please not only answer the call, but please come in straight away. It will be enormously advantageous to you and will certainly assist our nursing staff. As I said, they're very used to having doctors on call and only would do so once those queries have gone through an after-hours coordinator. So we'd be very pleased if you can come in. When we think about the colleagues you'll be working with at the larger hospitals, there are registrars, often training registrars, on secondment from Canberra or Sydney, advanced trainees in paediatrics at Bega, for example, and at Goulburn. The rest of the time you'll be working with really talented nursing staff. During the day, in terms of escalation, there are many people to talk to. All of our sites have a Director of Medical Services, and we'll make sure you're given their mobile number to call if there are any queries. All sites have a site manager, Director of Nursing during the day, or a Deputy Director of Nursing, and after hours there's an after hours coordinator or an after hours nurse manager, depending on the site. They're the eyes and ears of the hospital. They represent the executive and can provide you with assistance, advice and support after hours. We use New South Wales Pathology for our pathology, and we have a contracted radiology service, both of whom give excellent service, and you can seek advice and discussion after hours if need be. We are also actively participating in the New South Wales Telehealth Stroke Program, so that there's immediate access to a neurologist in the case of a stroke coming into the organisation. Most of our transfers will go to Canberra, which is our notional tertiary hospital. Although it's a different health service, we have really good relations with Canberra and they're very understanding of taking of our transfers. Some of the transfers from Goulburn will actually go via the Goulburn ED to Liverpool, as they have a relationship with them. But again, there are really senior people to be able to talk to if you need to at large tertiary hospitals. Sometimes you'll be asked to accept a patient, and we would ask you to do that. For the C1 hospitals, we really understand that the C2 hospitals don't have a lot of infrastructure to look after sick people, so we're very happy to participate and help them to look after the patients and do that with a minimum of fuss. This is a great organisation and the hospitals are really terrific. Our local doctors are really good and really committed to serving a rural community, as are our nursing and allied health staff. Those of us in executive roles take that role really seriously as well, and we want to make sure that you have a terrific time in working with us as a locum and may potentially be interested in staying with us on a permanent part-time or full-time basis if you really like the cut of our jib. So welcome. We really try to live the core values of New South Wales Health of collaboration, openness, respect and empowerment. Please call me at any time. My number is easily available. If you have any queries, concerns or any troubles at all, please call me. I'm really happy to help and I look forward to speaking with you all as we meet going forward. Thank you.